visible. Hiç options नहीं है necessarily.
I can't hear you. I can't hear you. But
No.
yeah, this is better. You can hear me?
Yes.
Good. What happened? Not getting connected?
No, there's some technical issue with adding Dr. Deep, so we are just doing
Waiting
that.
for that.
Yeah. So be there. Yeah.
Actually,
I'll
he
just
said he was able to see you and whether you could hear him. He asked that, I think so. Maybe.
is it. And then I just couldn't bring him on camera. So if I can do that with you, then
Yeah, you can do that with him as well. Let's try
yeah.
that now.
Let me see. Let me see. Yeah. Yeah. Be there.
Yeah, I'll be there.
Yes, he's there. So can you see and hear me?
Yes, I can see you. This is on the mobile, but I can't see you on the computer. So
Yeah, maybe that's why I couldn't add you. There must be some problem with the camera of the computer or something like that.
yeah, okay,
So
right.
yeah. Anyways, good morning, sir. And
Morning,
it's
morning.
actually very good morning here there because it's pretty little early for a Sunday morning. It
Yes,
must be
it's
6 o'clock in the morning.
6 o'clock. Yes, 6 o'clock now. So
Good morning, sir.
morning, Pali. How are you?
I'm doing well, sir. Very nice.
Good.
We're
This
lucky to have.
Rupali. Yeah, happy to have you. This is Dr. Rupali Dharwadkar. She is also one of our mentors for Part 3 and she has just passed and she has passed with flying colors, like one of the highest scorers.
So, well, you should be able to tell us more about what MRCOG is all about, right?
She is the most updated one.
Yeah.
I
Yeah.
just
So
enjoyed the process of giving that exam. Wonderful exam. I haven't really given any exam which is so beautiful so far.
Uh-huh. Okay. So did you take the exam from India?
Yes, sir. It was from India. All the three exams from India, and the last exam, the part 3, was at home, online through the Oslo.
Okay, right. So
Yes,
you can do the part 3 from India as well?
yes, sir.
yes,
And in fact, it was not even face to face. It was from home.
Okay,
This home.
right,
Otherwise,
right.
in
now
they use centers.
Yeah.
yeah, because of the COVID protocols. But then when I gave the exam, it was a physical exam, so it was offline. But it was in
Yeah,
India even at that time. So it's
right.
been all the three parts are in India since last 2 years. Like we can, and now that is the reason why it is an uprising question amongst all the
Yeah,
newcomers, and everyone is going for MRCOG, and that is
yeah,
why MRCOG.
yeah.
So
So
everyone
what
is
I was
asking.
hoping to do is I was hoping to share this presentation with you.
So before that, let me introduce you, because that is very, very important. You
Mm-hmm.
don't need an introduction. Everybody knows you. But
Mm-hmm.
for that, it's our honor to introduce you. Uh, we have with us Dr. Deep Datta, who is a consultant obstetrician gynecologist at United Kingdom. And Sir was honorary senior lecturer at King's College London School of Medicine. He was the council member of RCOG from 2012 to 2016. He was also member board of trustees of RCOG, council representative at RCOG Finance and Executive Committee, and also member of executive committee towards safe choices, enhanced clinical recovery lead in gynecology in the southeast coast of UK. And he was also an examiner for final MB at Guy's and St Thomas Hospitals, London. He is honored nationally and internationally with numerous prizes and citations, and he has got the RCOG Historical Leadership Lecturership Award in UK at in 2011, and the Hind Ratan Award in India in 2010. He's also called as a guest speaker at many national and international conferences, and that is why we call ourselves lucky to have him with us today.
Well, it's
Thank you, sir, for accepting the invitation. And
thank you.
believe me, uh, it was actually, I was very hesitant to call you on Facebook Live, because looking at your positions and the list of the achievements, your seniority. But as they
Well,
say that great men always have, they always show that it's humility which is important, and that I could
absolutely.
understand from the first time that we spoke. So actually called me. He told me not to call him sir, because that causes communication gaps, and that also shows how down to earth and humble he is. But then we have this hesitation of calling by name in India,
Yeah,
and that is why MRCOG is important. That's how it changes your perspective,
yeah,
how you it changes your personality, and it somehow changes your outlook towards your whole life in total.
yeah,
So
yeah.
what you get by achieving your goals is not as important as what you become by achieving your goals. So that is what I think about MRCOG.
Thank you so much, Preeti, for your very kind introduction. I am a very humble person, so I work a lot. But what I think is important is to pass on our legacy, because that's all that will remain. Because whatever we own today, material things, houses, cars, will become somebody else's tomorrow. That's not important. What's important is how your students remember you, in terms of what you pass on, the science and art of obstetrics and gynecology. And more importantly, even before the science, is how to treat women. You have to have respect for women. And especially very true for male gynecologists in India and abroad, because I think that is a big concern now. Treatment of women, like abortion rights in the United States, is a very big concern, that the fundamental rights of women are being tampered with. So I think that is what is important for us. So thank you so much. So what I thought I would do is, I'll tell you briefly about the MRCOG, which you guys know anyway. Everybody knows. So it's an internationally recognized. I'm just going to read off my slides, if that's okay, because I can't share it.
Yes.
So it's an internationally recognized qualification, and it's made up of 3 parts. And successful completion actually gives you the the nominals, post nominals, to write MRCOG after your name. And if you've been in MRCOG for 12 years, and you get 2 referees who are fellows who can nominate you to the fellowship, so then you get admitted as a fellow. So after 12 years from MRCOG, you become FRCOG. Okay, so that's a small ceremony, and you can come to the United Kingdom if you like. So that is the difference between MRCOG and FRCOG. So you might ask, or somebody might ask, how do some people become FRCOG without taking the exam? So like you have got some seniors in your country who have become fellows, like my very close friends, Rishikesh Pai and Rishma Pai and Narendra Malhotra and all. They are very good friends of mine. So in fact, I wrote up the nominations for both Rishikesh and Rishma. So basically what happens is, if somebody is quite established in their field, in their own country, and has made a mark in the contributions of obstetrics and gynecology over a period of decades in their country and beyond, then the council will invite applications from members and fellows for an honorary fellowship. Okay, and there are two kinds. One is fellowship adduendum, and one is fellowship honoris. So there are two. The adduendum is a slightly higher award, but the honorary fellowship, recently Nandita got it. So again, she's one of my friends. So basically what the council then does is looks at the nomination, and there is somebody else that seconds the nomination. For example, in Rishma's case, I had written the nomination, and my colleague here, Alison Wright, who used to be a vice president of the college, she seconded the nomination. And then the council will have several such applications from around the world, and then they will judge who they want to award the honorary fellowship. And so these people might not have taken the MRCG exam like you and I did, but they will get the honorary fellowship. So that is possible, but in a very few select cases. It won't happen to everybody, but the best way is probably to do the MRCOG yourself. Okay, so three parts, like I was saying: part 1, part 2, and part 3. Part 1, part 2 are the written exams. Okay, so the single best answer, SBA, and then you've got, I won't go into the details, you've got the EMQ part, and the part 3 obviously is the clinical application of your factual knowledge over the 2 years. So first part is the basic sciences, and then the second part is the ONG science, and the third part is the basic sciences. So so how long can I wait before taking the next part? I think a lot of people ask that. It's all on the MRCOG page in RCOG, isn't it?
Yes.
So it's 7 years actually.
Yeah, 7
If
years,
you want to
absolutely.
back council.
7 years. And I think after 2013, March 2013, you can attempt the part 2 within 7 years of the part 1, and part 3
They should
within 7 years of
attempt
part
at
2.
least. So even if they did not pass, that's okay. But they should have
Yeah,
at least attempted once within 7
once.
years.
Yeah, that is right. And the number of attempts, what do you know is the number of attempts? Do you know?
So I think for RCOG candidates, it is like for people who are working in UK specialty trainees, they have this limited number, say around 6 or something.
6
But
attempts,
for
you're right, 6 attempts. And part 3, it's 4 attempts. Okay,
yeah,
part 3 is
for
4
the
attempts.
UK trainees, yeah,
Okay, no, part 3 is 4 attempts for everybody.
everybody. Okay,
Yeah, part 3
that's
is 4 attempts for everybody. If somebody does not pass the part 3 within 4 attempts, they have to take the part 2 again.
Part 2, okay.
Okay, and all you said is right, within 7 years and all that. But if somebody has not passed the part 3 after 4 times, whether you are an UK trainee or you are from India or
outside.
Egypt or Sudan, you have to take the part 2 again. So, but it is very unlikely, because look, part 3 is the application of what you do every day. And what I tell my trainees is, just behave like you are in the clinic. When you're in the exam hall, behave like you're in the clinic. And when you're in the clinic, think that you're in the exam.
Yes, sir.
Yeah, that
Yeah,
somebody
that's
is
good.
observing you.
That's something to take home, like something I can
Yeah,
tell my students also.
yeah. Just say that. Imagine somebody is watching you. In the United States, they do the certification, a board certification exam through one-way glass doors. Okay, so they do OSCEs and they see your patient interaction. You can't see them, but the examiners are seeing you. Okay, so different countries have different ways of evaluation, and I think if you imagine that when you are in a clinic, you imagine that you are being examined and somebody is watching you. I think that is how you subconsciously prepare, and I have always told my students to actually
Yes.
prepare like that.
Aditya, I think the difference between the approach, part three exam becomes difficult for Indian students is because the entire
Yeah.
approach we have here when we are communicating with patients is totally different from the approach which I learned as an MRC while giving my part three MRCOG. It's a totally different approach, and I'm now incorporating it in my communication with patients, and believe me, it is making wonders. The empathy, the way we talk, and we give patients the choices. Initially I used to give my word, like, this is the treatment for you,
Yeah,
but
I
right now
agree
I
with
offer them the choices, and when you offer, the patients feel they're kept on a different pedestal and they feel very good to make the choices. So
Yeah.
it's kind of bringing out a big difference here.
Okay, absolutely. I completely agree. And I think your perspective on healthcare for women changes drastically with the
Yes,
qualification, because it not only evaluates your knowledge in ONG, but also, you know, discussion, consent taking, a lot of things. Like you take the wishes of the family, where an individual is incapable of taking consent. In here in UK, it's a big thing. If
yes,
there is a girl who, for example, has got um, a lot of educational needs and cannot make decisions, so who makes the decisions for contraception? Okay, so there is somebody who has got a medical attorney, power of attorney, not financial power of attorney, that's different. Medical power of attorney who can actually decide on her behalf to say, yes, a Marina coil might be more appropriate for her because she is educationally subnormal, or is not able to make decisions. So it's a very complex thing. Consent taking is a very complex thing, or end of life care, consent in end of life, especially ovarian cancer stage 4 and so on. So all of those things which you take for granted in India sometimes is not. So you are right, Rupali. The perspective of thinking and application of your factual knowledge is so different, and I think that is what it should be.
yes,
That's what it should be. So a lot of people ask, is MRCG relevant for practice in India? you know
right.
so yeah, so I prepared a slide for that. So is MRCG relevant? So MRCG तो यूके का एग्जाम है, वो लेके हम यहाँ पे क्या करें? मैंने एमडी कर
Right.
लिया है, मैंने डीएनबी कर लिया है, तो MRCG का क्या फायदा? Okay, so I'm going to say one or two things, and you might know this yourself. First, it gains you more respect amongst patient population. There is no question about it. That is true even when I did my MRCOG in 1994. Okay, I did it in 1994, long time ago. So even then it was true. And also MRCOG gains more respect amongst your own brethren. So your own ONG fraternity, you have a little more acknowledgement. Okay. So, and then there is the AICC RCOG, which you are a member of because you're a MRCOG. So that is one thing. Secondly, you can remain up to date on your skills and patient care through the BJOG, the British Journal of ONG. And then you have got an RCOG online appraisal system. You can do appraisals on your own if you like. You can have an e-portfolio and you can submit documents and certification. Why is that important? So if you are ever in a court case, at least here, okay, and the judge asks you to prove your credentials, to say, okay, I know this forceps resulted in that damage or whatever, but how do I know you are a safe practitioner? So you say, I've been doing appraisals, I've been logging my cases, I've been having so many cases without any complications. This is the first one that I had in 2022, which resulted in baby skull fracture and death. So then the judge is more likely to take a lenient view than if you didn't have any record or you didn't have any belonging or ownership of an appraisal system. And I think that is an important thing. At least here it is. Okay. And in India, I think a judge is more likely to look upon you kindly if you can demonstrate that you are a practitioner who not only practices science and art of ONG, but also uh, uh, is very thorough with documentation and recording. So that is the third thing. Patient safety. I think you're more aware of patient safety if you are if you have a qualification abroad. And one of the very important things is if you've got an MRCOG, then you can, if you like, come work here, okay, for a period of time, if you like. You don't have to follow a specialist registrar grade or anything, but you can come and work. You can get a GMC registration, and you'll be able to now get a locum post or something like that. So you can, top up your income if you like, or spend some time here. Some people do that, take a break from practice in India and come and practice here. So that is possible. So, okay.
So again, there is one more thing that is different from the Indian scenario is the audits, because and the research work, which is different from the Indian educational system.
I think audit should be a part of your I mean, most of us do some audit. When you go and present papers, you are, quoting some kind of studies, no? Like if you're doing a total number of lapistrectomies, you tell them, what kind of return to theater you have, what is your incidence of infection rate. And I think we all discuss that so I think subconsciously you are auditing your figures. It's a good thing to have an audit trail and re-audit. Sometimes your juniors can do that for you when you're in senior positions. Your juniors can, and that can form part of their CV also. So yes, I think you don't have to do it all yourself, but some of it you can have other people to do. So
It
just
increases the goals.
yeah, go on.
It's somehow it like while doing MRCG, when we are doing part 3 specifically, we come to know many more things about research and how to go about it, because that is
Yeah,
hardly taught during
in
the
India.
MBBS or
Yeah,
PGs.
I think that is a bit of a shame, because when I was growing up and doing my MD in India, I did my MD in BJ Medical College in Ahmedabad. I've got good memories of that. Um, so when I did my MD, research was not a very big thrust of the job. I think the pressure of work is so much in India that there is not much time for research. I can fully understand that. But until you do research in the Indian context, you will not know what are the requirements. For example, colposcopy and screening for cervical dyskaryosis is completely different in the Indian context and in the UK context, isn't it? In
Yes.
the Indian context, you are more keen on preventing cervical cancer because a lot of people are dying of cervical cancer. Whereas here, you're trying to address the psychological morbidity from dyskaryosis diagnosis or HPV diagnosis. So the thrust is completely different. And I think that is why it's important. I think more government investment and also industry investment needs to be done. All these big companies or health or big pharma companies, they need to invest more in research. So can I work in the UK after MRCOG? That's a lot of question. People ask a lot of question on that. Can I work in the UK after MRCOG?
And as consultant, that is the main question, because they have already passed their MS and MDs here, and
Yeah.
we become consultant here after that.
Yeah.
So
Okay. So once you complete your MRCOG, to get a post in the UK, you need a GMC registration, General Medical Council, which is the same as NMC in India. You used to have the IMA. The IMA has now been replaced by the NMC. Is that right?
Yes, sir.
Yeah. So like NMC, we've got the General Medical Council. So General Medical Council registration is required. That's not very hard. You apply online, and most times the registration is granted online. In fact, like I was saying earlier, if you want to come here and work for 3 months or something, you need a registration. So every hospital will check that. Okay. So if somebody wants to work here for a long time and become a consultant, I think that's what the question is. How do you do that? So let me tell you what happens here. So I'm going to take you to a slide which I was hoping to show you. So here what happens is, so you do 4.5 years of MBBS here, okay, in UK. Then you do FY1, which is foundation year 1, foundation year 2, FY1, FY2, which is equivalent to our internship. Now, after FY2, there is a selection process to specialist training. We call it ST. Okay, ST. ST is specialist training. So for ST in medicine, there is a separate round of interviews. ST in surgery, there's a separate round of interviews. ST in ONG, there'll be a round of interviews. And this will be national, all over the UK. So if somebody is successful, a UK graduate, then they will get enrolled as ST1 or the first year of specialist training. So ST1, ST2 is the basic foundation. So they'll learn the basics. So that's what they'll learn. ST3 to ST5, so 3 years, they'll do specialist training. So they will do like routine ONG and they will pass their exam. By ST5, they should have passed the part 3. And ST6 and 7 is advanced training. So there they will do what we call ATSMs, or advanced training special skills module. So they'll do ATSM in colposcopy or maternal medicine or scanning or ambulatory gynecology. And after ST7, they will get a CCT, or a certificate of completion of training, CCT. So imagine if somebody is MBBS at the age of 24, no, 18, so 23, okay? At the age of 18, if they go in, so by the time 4.5 years or 5 years is 23, right? Okay, so 2 years, FY1, FY2, that will be 25, yeah? So 25, even if they don't lose any years, so 25 he gets into ST1. So by the time he's 32, he will be ST7. Okay, so that's the earliest somebody can expect to get a consultant post. In reality, what happens is they get a consultant post close to late 30s because a CCT is not enough. So what they do is sometimes they do super specialization. They'll do 2 years in gyne-oncology or urogynecology or something, and so on. Or they will do research. Okay, if you do research or subspecialization, sometimes you'll have to do 2 years of gyne-oncology plus 1 year of research. So that takes you to 35 anyway. And there will be loss of years, especially for women. If you're going to take time out for pregnancies and so on, they'll be a bit longer. So even for men, I think it's very hard to make it to 35 or 36. By the time you're looking at a consultant post, you're late 30s, early 40s. So you've given up a huge part of your career. So of your life to actually get a consultant post. Okay, so it is hard. Now, what happens to somebody from India is your question. So if they want to get into this, so they will have to undergo some kind of specialist training. Okay, so if you say, oh, I'm too experienced, I can't do ST1, ST2 again, right? I think I'm at a level of ST5 or ST6. You will not automatically get into ST5, ST6. Now, there are no interviews for candidates who have trained abroad, or international medical graduates, as we call them, IMGs. Okay, for IMGs, there is no direct entry into ST3, ST4, or anything like that. I'll give you an example. If somebody is married to a British citizen, for example, okay, somebody is married to a British citizen and has got MRCOG and has come here and has got right of permanent residence. Okay, so now they want to enter into OBGY, but they have not graduated from here. They have graduated from Pune or Hyderabad or somewhere else. So what she can do is she can apply to ST3 entry. Okay, you have to do minimum ST3 entry. So ST3 entry, there is a separate round of interviews for ST3 all around
Yes.
the nation, ST3. So you can get in an ST3. Once you get in ST3, you say, well, look, I've got MRCOG, I've got 6 years of experience in India. I think I should be at ST6 level. So they'll say,
Right.
okay, if you do 1 year, then we will assess and put you in ST5 or ST6, because they will see your fluency and your adapting to the UK system working, and then they will make that grade adjustment or the year adjustment. So they'll do that. Okay. Now, for example, if somebody is not married, so they are coming and the MTI scheme. You know of the MTI scheme? Okay. So what is the MTI scheme? The MTI scheme is Medical Training Initiative. Basically, they will ask you to apply. So the MTI process is a bit lengthy, but it's quite easy to do. I have myself recruited a lot of people from India, Egypt, Sudan, and so on. So what happens is that the RCOG has got every year um, a fixed number of MTI trainees it will take, roughly about 60. Okay, and this is from all around the world. So post MRCOG, people can apply for that. Now, once they apply for that, then the RCOG MTI office asks for hospitals around the country to express an interest of who wants them. Not all hospitals will want that. So like, for example, my hospital, we usually take 1 or 2 every year. Okay. So then they will write to me, because I'm the college tutor. I am in charge of recruitment. So I will then say, yes, we will take 2 this year. Starting in August 2023, we will take 2. So in 2022, the selection process will happen. Then the college will match 2 candidates to me, or 3 candidates, and we'll do Skype interviews. So they will send CVs and everything. Then we will do Skype interviews, and then I'll say, out of these 5 people, we will have 2, and then we then write those names to the college. The hospital will write those names to the college, and then the hospital officially pays the RCOG £3,000 for this, because the RCOG is, well, trying to earn money, isn't it? So they will get £3,000 from the hospital, but the hospital will formally acknowledge that their college tutor in ONG, that is me, has authorized these 2 people to join. So then the RCOG will apply for certificate of sponsorship. So that is COS, okay, certification of sponsorship, from the Academy of Medical Sciences. Okay, Academy of Medical Sciences. So the certificate of sponsorship is very important, because the certificate of sponsorship is something that entitles the doctor for a tier 5 visa. So visa in the UK is granted on terms of tiers, depending on skills and experience. Tier 5 is a skilled person. Right? So tier 5 visa ke liye you need the COS, or the certificate of sponsorship. So once the candidate gets the certificate of sponsorship, then so the doctor's full name needs to match the one on the MTI application form, GMC application form, and the certificate of sponsorship, because it's important for the Home Office, which will grant the visa, plus the hospital payroll, because they'll need to pay the person, right, when they join. And then the tier 5 visa has to be applied from the home country. So if a person is resident here, they have to go back to India, apply for the visa from the British High Commission. But because you've got the COS, you'll get the tier 5 visa, and then you can join. So the person who joins as a MTI will usually join at an SHO level or an ST1, ST2 level. Okay, so there is not much point in applying for MTI if you are further down your career, if you've done a lot of work in India, because then you will find like ये तो मैं कब का कर हाँ, I've done this long time ago. I don't want to do this all over again, because you will be putting Venflons in and writing medicine scripts and so on. People get frustrated. So I think people earlier in the career who are past their MRCG and done maybe 2-3 years or something, yes, that's MTI is good for them. Now the tier 5 visa is valid for the person to stay in the UAE for exactly 2 years. Okay, 2 years. Acha. So now what do you do if you want to stay longer? So which has happened? So what they do is they then apply for the ST3 entry. Once you gain a foothold in the UK with a tier 5 visa, you get to apply for the ST3s, because you say, look, I've done my MRCOG, because MRCOG is the minimum criteria for MTI. I've done my MRCOG, I've done this experience in such and such hospital in the UK, and ST3. I couldn't join ST1 because ST1 was quite early, was done, and ST1 usually UK graduates get in, and ST3. So ST3, once they get in, if they get in the ST3, then you get a tier 2 visa. Tier 2 visa is something that entitles you to stay or indefinite leave for remain. So they will say indefinite leave to remain, which means you can remain for as long as you like. Okay. And after 7 years of indefinite leave for remain, you can apply for citizenship. So the difference between tier 2 visa and tier 5 visa is tier 5 visa, you can't apply for a mortgage. Here, you can't buy a house, because they are saying you will go back after 2 years, so you can't buy a house. But once you get a tier 2 and your intention is to settle here, then you can apply for a mortgage. So that's the difference between tier 2 and tier 5. But the initial entry will not be tier 2, it will be tier 5. Unless somebody is married to a British citizen, in which case, obviously, you've got all rights and so on. So that is the MTI scheme, the tier 5 explanation and the tier 2. Is that clear? Tell me. Yeah.
So one more question I wanted now regarding this GMC registration, which you have said. Suppose a person has done MRCOG in India and wants to apply for an on-job training, like they have the basic knowledge of, say, infertility, and they would like to do a job there, maybe in the NHS or the private sector. Either of this, they will need a GMC registration. So is it wise to do the GMC registration and keep and then apply for the job? Or you apply for the job and get the employer's certificate or something, and then the GMC registration is faster?
Good question. I think if you get the job, the GMC is under pressure to give the registration quickly. I mean, either way, they usually take no more than 4 weeks.
And what are the ways in which we can apply for on-job trainings?
So you are talking about specialist training?
Yes, sir, specialist.
Or special training. So basically what it is, say for example, you want to do, you want to come here and work only with reproductive medicine. Okay, yes. Say for example, okay. Yes. So you in fact, you're not doing general ONG in India, you do only IVF, and you want to come here and practice only IVF.
Or okay. Learn, practice or learn. We know the basics.
Or learn.
So, yeah. But I want to do on-job training, suppose. So in that, what are the options there?
So you need to, so then what happens is that person needs to find a sponsor who will, so this is not, then you don't go through the MTI scheme.
Yes, right.
So the MTI scheme is for general ONG, yes, and for career and somebody wanting to do a specialist training, etc., etc. Okay. So for this one that you're talking about, what you do is you find a sponsor. For example, I'll give you an example. Say you have a very good infertility professional, Anil Goody, who's my friend in Homerton Hospital, and Amit Shah is somebody I trained with. He was my year in MD in BJ Medical College in Ahmedabad. So you write to them to say, can I be part of your team in Homerton Hospital? Okay, so then they will write to their employer and say this person wants to come and practice fertility in my unit. So
We
the hospital
totally
will try to get a COS for you, or certificate of sponsorship, and you'll be able to get in. But there'll be conditions on the GMC registration. There'll be conditions on practice. So you cannot practice general ONG, for example.
Yes.
Okay. So for example, you are doing only reproductive medicine and you say, okay, I know a bit of obstetrics. Can I earn a bit of money through a locum weekend or something? I'm free on the weekend. Can I go and work in that hospital 5 miles away and earn some money? So for that, the GMC might put a limitation because they have not tested you in general obstetrics. Okay, so they might, but eventually it is possible to get. Eventually it's possible to get. So you can work in reproductive endocrinology, or you can learn and you can practice and help and provide service and so on, and earn an income and so on and so forth. Now, if that person wants to now get a consultant post, okay, in obstetrics and gynecology, it's preferable that they have some exposure to general ONG, because the CCT that is given, it is for obstetrics and gynecology. You don't get a CCT for reproductive medicine, okay, or gynae oncology. You don't get a CCT. So you get a CCT for everything, the whole discipline. Even gynae oncologists or urogynecologists get a CCT in ONG, and then they have a subspecialist accreditation separate. That's different. So they've got a separate license to do urogynecology or something. So then the other route of getting to a consultant instead of the CCT is something we call CESR, or Certificate of Specialist Registration, CESR. So the CESR is something that the college will look at. So if you say, well, this is my experience in India, this is my experience in the UK, this is my evidence of my experience in ONG in India and the UK, I am applying for a CESR. So I am not interested in CCT because that involves training in your system, but I want CESR, or Certificate of Specialist Registration. So then the college will evaluate that application and say, yes, this person is suitable for CSR, and will grant you a CSR. So when you get the CSR, you are at a similar level as a CCT holder to apply for a consultant position. Now, what usually happens on the ground is when interviews happen, the consultant position is usually given to CCT holders. Why? Because the employing authority knows that this person has been through the whole grind of the system.
That's right.
Where the CSR is not a shortcut, because the CSR will be more experienced. They have got a lot of experience. But the CSR has not done nights on call as an ST1, ST2, etc. So if you don't know what an ST1, ST2 does, how will you know what to expect as a consultant? You know, how do you know what a registrar does, or how much a registrar can do? How do you know a trial of forceps is something where you should come in from home and supervise, or you can let somebody do? But if you are in the same hospital, then they can appoint you for a consultant position if they know you. Your CSR is good enough, so you can still apply.
Thank you so much, sir. That was quite informative. Very much. Thank you very much.
Was that clear?
Yeah.
Did you understand?
Yes, very much clear,
Yes,
sir.
very much clear.
Okay.
Yeah. Again, this question is coming up every now and then, whether it is recognized in India. Yes, it is, and it is a MCI recognized degree, MRCOG, and you can get all the benefits as you get for any other MCI recognized degree. It's just that there was no awareness when I actually called MCI before I sat for this exam. They told me that you will get all the benefits of an MCI recognized degree. So, which actually meant that I can apply for the final DNB. That was the exam that was in my mind before I gave the MRCG. I don't know. Somehow after being MRCG, I did not find any reason to go for DNB. Maybe if I have to. But then you can sit for final exams. If you have done your DGOs and then you want to go for DNB, you have to do training here for 2 more years, which is again, as you said, for women it is not possible because then they go into marriage and then they have kids and then to go back to training again is difficult. So if you want to get final DNB exams, you can directly get after you have done your MRCOG. And MRCOG, if you're doing from India, you don't have to really go for training anywhere. You can sit at home and while doing your private practice, you can give all the three parts. So that's again a easy thing, at least for the Indian candidates, because somehow it's you actually just applying what you're doing in your clinics or at your jobs. So again, that is a benefit that you get an international recognized degree, and you don't have to actually leave your home.
But we will have to apply for the additional qualification with the state board. That is there. Without that,
Yeah,
we cannot apply those degrees. Any
yeah, but
degree
then
which
again,
take, yeah,
that's
unless
just
and
a
until
format.
you get, yeah, but still, unless and until you get that additional qualification certified from the state board, we cannot apply those degrees. That is how it is always, always. And sir, is it that every year we have to pay a signed, a specific amount so that we can continue with this membership?
Membership.
That is also there. And
Yes,
one
yes.
more question, sir. You made it very clear so far as the private subspecialty applications are concerned. But are there any on-job training, say for 1 or 2 years, so far as NHS is concerned, where we can apply for subspecialty trainings? And if yes, then which is the mode for that?
So, if I've got your question correctly, you are asking, can you apply for subspecialty training in the
And
UK?
in NHS hospitals, say for a 1 year or a 2 years, where again I need to have an on-job training. I have basic knowledge in infertility. Now I want to upgrade my skills and in the right manner and learn it from the right doctors there. So it could be like an on-job training. So like for a 1 year or a 2 year, maybe I don't know what it is called. It's called a fellowship there or a subspecialty training. I don't know what it is. And if we need to apply for that, what is the way we apply for that?
Okay, so there are four subspecialties in ONG. One is gynae-oncology, maternal and fetal medicine, reproductive medicine, and urogynecology.
Yes, sir. So reproductive medicine, if we want to apply, then what is the mode? Like for private, you said write to the doctor concerned and ask for it. So for this, in we went to go to the NHS hospitals, how do we apply that? Because
Okay.
every person who does MRCOG might someday want to qualify. Think about that option also.
Okay. Is there an echo in this live video? Can
No,
you hear yourself again?
No, no, sir.
no.
No.
I can hear myself clearly.
Okay. No. Okay. So, what do you do if you want to subspecialize in ONG? That's what you're asking.
Yes, sir. In the NHS sector, NHS
Yeah.
hospital. So how does a person who's done an MRCOG here apply for the same there?
Yeah. So, yeah. So the best thing to do, say for example, you are a fertility specialist. So you then, like I was saying, you identify a hospital and somebody who can sponsor you, and they will then ask their hospital administrator to apply for a certificate of sponsorship for you.
So
And
just So you have some problem with the ecos. Maybe if you shut your computer, like maybe that is the reason. Because we are not getting any ecos or.
Yeah. I'm going to take my computer away. Just a sec. Somewhere else. That's fine. Okay. So, yeah, tell me.
So you want me to repeat my question? My question was, as you said, for a private sector, you have to apply for the doctor concerned that I'm interested. Now, if I want a job in NHS, like 1 year or 1.5 year subspecialty training in reproductive medicine, then what is the right approach? Should I go through the NHS.jobs which is there, or should I apply to any particular person who's there in the hospital which I have kind of, shortlisted? How do we go about it? It may be for any subspecialty because there are so many people who are doing MRCOG who want to try a stint there in UK for 2 years, learn the things and come back again. So they might not be wanting to become a consultant there, but upgrade their skills. They may be knowing the basic infertility or basic onco here, but they want to upgrade the skills. So if they want to go through NHS, because I believe private sectors would really want people who would work for them directly, and there wouldn't be a lot of training there. There would be more of a job, and in the process you learn. But in NHS, it would be they would be taken as fellows, and then there the tutoring would be really good. So even if you're a consultant in India, going there and doing the 1 year or 2 years what you call subspecialty training in the said field would really help them upgrade and learn the skill in the right manner. So how do we go about for that? Because the ST7 and all those who finish off, they go for these, as you said, 2 years of training, and for them approaching those things become easy. But a doctor in India, if they want to do, because they would be competing with those people for that said post. So is there scope for anyone sitting here in India to apply for that? And if yes, how would they go about it?
Yeah. Right. That's a very good question. So I'm going to break it up into two parts. Um, sorry, I've come to a different room to try.
Yes, so we can hear you.
Yeah.
We
Okay.
can hear you,
So,
and let us
so
know
what?
if there are some technical issues, sir, so that I
Yeah.
have a technical team. We can just sort that out.
Okay. So what happens is if you apply through the NHS, then you can apply through NHS jobs or BMJ classifieds. You can do that. But one of the things that they will want is your GM registration.
So we have to do the GMC registration first in these cases.
Yeah. Because they will not entertain an application without a GMC registration. So,
Yeah, that's a very important point, sir. Thank you so
yeah.
much.
Okay. The second thing you have to consider, the second thing you have to consider, yeah, the second thing you have to consider is that you will be competing for training opportunities with people who are doing the subspecialization in reproductive endocrinology, for example.
Yes.
Okay.
Yes.
So from the point of view of the NHS or the establishment, they are going to ask themselves the question, okay, why should we invest in this person who is coming for 2 years and going to go back to India because they are not going to contribute to the UK health economy.
Yes, sir. So is
Yeah.
there any way where, sir, any other way where a person who has done an MRCOG here and who has an intense desire to come there and study for 2 years, learn it in the right manner and come back, is there any other way where that person
I
can
think, yeah,
be?
yeah, I the best thing is probably, then go through a private institution for that. Okay. So the private institution, their motive, everybody has got a motive,
Yes, sir.
In life, everybody's got a motive.
Yes, sir. True.
So apart from people who are in ashrams, everybody has got motive. Okay. So in private, their motive is that that they will get work out of you.
Yes, sir.
Okay. Say they'll get you to do egg retrieval on Saturday. Okay. All right. So
Yes.
in return, they might help you understand or train you with egg freezing or whatever. I don't know much about reproductive, but that's what they're going to train you, because it's a give and take. You
Correct.
give your service, you learn a bit.
Okay.
And while you are doing it, you can actually get a part-time NHS contractor also. Okay.
Okay.
Because this consultant who is actually doing private work is usually attached to a NHS hospital.
Yes.
So they'll be able to get you a part contract in an NHS hospital. That way you get both the volume of the NHS work plus the private, which you get an exposure to. So
Correct.
I think that is the best way to go about it. The RCOG will not actively sponsor you for that,
Yeah, that's
because they have got their own people who are chasing subspecializations in reproductive medicine,
yes, sir. Right.
and they will be contributing to reproductive medicine in the UK for the next 20 years.
Correct. So they would find it more. They would find it better to invest in that person rather than any Indian who
Yeah,
would have a short stint.
yeah.
Very true. Thank you. That
Isn't
was
it?
very, very informative, sir. Thank you
I
very
mean,
much.
why would you? Yeah, I mean, it's a simple question. Why would you train a man? Yeah, would you train a medical doctor from Nigeria in your infertility clinic, and he says, I'm going to go back to Nigeria in 2 years' time? What is your benefit?
Very true, sir. Very true.
Isn't it? I'm telling you the fact on the ground. I mean, that's what.
No, it's very
Yeah.
honest, and that's what we are looking out for. Extremely. Thank you very much for that honest, what you call, information which you have provided, because that will
But
help
Yeah.
many
it
people
it
who
is
are
not
here
impossible.
to apply.
Yeah, it is not impossible. It is possible to do. I know. So there is one person called Anu Chawla. Have you heard of Anu Chawla? You've
Yes,
heard of
I've
her.
had a word with her as well. I've heard
Yeah,
about her.
So
I know she's a friend.
yeah, so she has been in touch with me, and I have guided her on how she has come. She came initially through private sector and then went into NHS.
Okay.
Yes, but again,
So
she
it's
had
better to
the intention of staying back in UK.
Yeah, that's
That
right.
was the one thing which would have got to the
But
NHS.
you don't need to declare that when you come.
Yeah, that's true, sir. That's very true.
You
so
actually say, I want to
that's
stay back in the UK. Maybe they'll
yeah.
train you more.
Yeah,
You never know.
that is nice take home message for all those people who will be liking to apply for the same.
Because that's why this degrees which are international, these international degrees, they should help you in some way, because you should get to learn something from countries outside India also, like outside your
I
own
agree.
country. And only then it is going to be of some benefit to you and your country also.
And especially
So
when
the
you
country.
have a membership from that college, why not try a stint in UK for 2 years? That is most of the people who may think of it. You may definitely
Yeah,
upgrade your skills here, but after having the degree, doing a stint there, it always makes a huge difference.
because yeah, again, people ask how many years do we require to pass MRCOG? So that's a lot of work actually, because we also put in exactly the same amount of studies and
Yes,
energy and
tougher,
money and
much
everything.
tougher sitting
So
in India and giving the exam. The exam is
yeah,
not tough. Part three
No,
is not tough, but the only thing is sitting in India and giving the exam is tough. What makes
yeah.
it tough?
yeah.
You don't know the
It's all
system. You don't know.
calculation. Yeah.
Yes. In
You don't
fact,
know the
part two is the
system.
toughest, I feel. Part two, if you clear part two, then part 3 you can you really can get a mentor
Yeah.
and get it
There
in
should
your
be,
system.
I think with Rupali coming up with this topic, I think there should be some request for people like us also, like, who are actually putting in so much of work and getting this degree, and again we are again
Yes,
advertising this MRCOG for in some or the other way in our country also. So even we
yes,
should get some,
that was
at
precisely
least
the
one from learning. Yeah.
that's precisely the reason why I wanted to help as a mentor as well, because I thought when I was studying, I didn't get the real help from many people. So right now, I want to give back as much as possible, and we can do that. And already started, as you see. Yes.
Yeah, you have already started, and she's really doing well with part three candidates nowadays. Specifically, the very much like people keep on asking where else apart from UK can I have job opportunities, and where else is it recognized outside India and UK? So, which other countries? So,
Okay.
so do you have any idea about this?
Okay. So the countries that there are about more than 100 countries that recognize the MRCOG. So you have countries like Australia and New Zealand which have reciprocal recognition.
Hmm.
Okay.
Right.
So you can find employment in any English speaking countries like South Africa, New Zealand, Australia, and also the Middle East. The Middle East is a big market for especially women gynecologists
Especially
who
Dubai also.
are, yeah,
Dubai.
and even if you're not fluent in Arabic, I mean they will have you because it carries they either get a board certification from the United States or so it opens up a lot of job opportunities in the Middle East and other, for sure there is no question.
But it's not recognized in America. So the
No,
US. So
yeah,
people who are
US has its own board certification. So US,
right. So
so
that's
in
what they
US you
most people
actually
want.
need a separate license to practice in Florida or in Oklahoma or in California. You need separate license for each state.
Even in Canada, for
Yeah,
Canada also. Yeah.
for also. So yes, that's a bit different. But for US, you need US to get in anyway.
Right. So
The
basically,
US.
in UAE, it's recognized. You can get a good post, upgradation of your post in UAE, Saudi Arabia, uh, and most part of Asian countries also, and UK as well. So that's a big number of countries, like more than 100 countries. So that's a good opportunity for anyone who wants to have a job outside India also. And yes, again, they keep on asking whether you can become MRCOG after MBBS. So you require 4 years of training even before you give your part three. So you need to have 4 years of training in OBGY. So someone who has just passed out MBBS cannot directly go for MRCOG, even if you are working outside UK. So, and you cannot pass the part two also if you have not worked in
Yeah,
OBGY. So
yeah.
it's difficult to get through the guidelines and all. And it's I always about part two, I always say that it's God's love. It's like so
It's
vast.
a tough one. Part two is tougher than part three, I think.
Yes,
Yeah.
very tough.
So it's
Very tough.
you cannot finish the portion. It's that's what I say. It's like God's love. It's so vast you can't get around it.
It's
So
a
high
universe,
you can't get over it.
like a
So
universe.
yeah, so it's difficult. Like so, someone who has not worked in OBGY, if you want to go for MRCOG, that's not possible. You need to have at least 4 years of training, and 6 months of consecutive training for one post is required in any hospital, private or government hospital. So that is okay. So that is what we call as application of training, AOT, before part 3. So you just have to send mails to RCOG and they'll guide you for those who want to know the basics of whether they can be MRCOG even after MBBS. So this is the question. Again, there is this question that Dr. Shantanu Maiti is asking, if that is, if I'm sorry if I've pronounced it wrongly, but then what will be the salary structure in UK after MRCOG, sir? I don't have any idea about this.
So the salary structure is depends on where you get it. So for an MTI trainee, the salary structure will depend on past experience. So the number of years of past experience pre-MTI will determine the salary grade.
Okay.
Okay, so to give you an idea, the salary is 50 and 55,000 pounds per year, roughly.
So we couldn't hear that.
So,
We couldn't hear.
so for somebody who's done 4 or 5 years of ONG and has done, so somebody who's done 4 to 5 years of ONG and comes to an MTI program, they can expect to get between 50 and 55,000 per year.
50 and 60. What is
50 and
that, sir?
55, 50 and 55,000 pounds per year. 55.
So that's okay. So that's a good amount.
Yeah. Yeah.
And so they have asked what type of private organizations are available in UK. So you can apply to any private college for getting subspecialty training or getting jobs for ST5 and all.
Private, see, private, say for example, if there are private IVF clinics, you can apply to work in a private clinic. You know, like the Geeta Nargan runs a very big private organization in IVF in the UK. So, and yes, they have their own pace. They have their own pace.
Okay. Okay, sir. So I think most of the questions are almost over. Like these are the questions they keep on asking every now and then, and like ideas about why they should go for MRCOG and what are the opportunities after MRCOG are almost clear. If there's any extra thing that anyone wants to ask, please last 5 minutes we can because sir has been with us for a very long time. Like it's been 1.5 years and somehow can't hear. So can you hear me?
Yes, I can hear you. Can you hear me?
Rupali can't hear me.
Okay. I
Uh,
can hear. Yes, I can hear everybody.
yes, yes. So okay, then if you want to ask any question, like we can continue this for last 5 minutes. Rupali, you have to wait. I have no option. Please wait. Only sign languages are going to work now because I'm not very good with technicalities. Okay, so many people can't hear. So I think maybe there is some problem with my audio.
Okay.
Sir is there.
Yes, yes, I can
Yeah,
hear
yeah,
you. Yeah,
yeah.
I can
So,
hear.
and yes, and rest of the people were actually asking about the courses that I conduct, and also I actually give them guidance. It's not that I teach them because they are all gynecologists and they don't, like many of them are actually senior to me. So we don't have that thing of teaching people, but then of course we give them guidance as you have like very beautifully today you have explained most of the benefits of MRCOG and how it happens, like the parts and how to go about it. So we just provide them with the syllabus, the important books, and how to keep the preparation. So anyone who wants to be in the course can actually directly message me. And thank you very much, sir, for being with us. And it's of absolute pleasure. Like this is going to boost all the mentors.
No
Like it is
problem.
going to be a motivation for all of us.
I can come to
And
one
I
of
hope
your courses and do a small talk if you like. Of your course.
yes, yes, we'll do that. Seriously. Yes, I think yeah. Rupali can't hear me even right. Can't hear. Okay, she's
Okay.
writing. Anyways, and sir, it must be really late now. You didn't even have your breakfast before, so
No,
thank
that's
you for
fine.
giving us. And sir, how was it like? Did you like the conversation and all?
Yes, yes, it was good. Got few technical issues, but it was good.
Yeah. So we'll do that next time. Thank you very much, sir.
Sure.
Thank you for your time.
Thank you.